I remember my very first house call visit. I went out with a previous speaker in this series, Eric DeYoung. He took me out in Baltimore. The mother was living in her living room. The bed had been brought down to the living room, which was just inside the front door. Her daughter and grandchildren were helping to care for her. And Eric provided the most extraordinary care and exuded warmth and supported the questions of the family around the care. And this woman would have ended up in a nursing home otherwise. She definitely would have been in a nursing home otherwise. And she was well supported and she was happy and she was surrounded by her family. Everyone was better for it. It was remarkable. So thank you to Eric if you're listening to this. It really, it's an inspiration. That was many years ago, but thank you, Eric.
I love house calls because of the family pictures. I get to go to the home and I see all the pictures of the patient at every stage of their life, and see all the people who are important to them in their life. And so I love the history of learning about my patient, but not just because it feels good, but because it then allows me to take better care of them. Because if I understand their culture and their family and their home environment, I have information that allows me to make better decisions about their medical problems, about their end of life when it comes to that. And I'm kind of a guest and a part of the family in doing so. So it's tremendous, honor to be in that situation, which I honestly don't feel when patients come into the office.
Oh, that's a good question. I love house calls for a lot of different reasons. I love getting to know my patients' families and friends and neighbors and seeing the whole world that they live in. I love house calls because I think I am able to provide a much higher level of care for that particular patient than I would if they were coming into the office. I'm able to go through their medications really carefully with them in the home, so I actually know what's going on with those medications, which sometimes can be very hard to do in the office. And I just love getting to know my patients, in their living room.
Well, I love house calls because of things like that, because of observing miracles. We do see miracles every day. I did have a love for house calls before joining MD at Home. Like plenty of others in the community, I had no idea home-based primary care existed in the US. I'm originally from Egypt. We had a family doctor who used to come and see us from when we were babies. He saw everybody in the family. He knew about everybody, and he was there for us on events, and he saved our family members who were misdiagnosed in facilities. And so when I got into medicine, I thought to myself, I wish there is such a thing. House calls is what we call it in Egypt. I wish there are house calls here in the US. And so I ran into MD at Home, and I couldn't believe it. And every day I try to bring this doctor to life through the different programs that we roll out and through my training to every provider to make sure that whatever he did for my family is out there for our extended family here in the Chicago community, our patients.
Yeah, so many reasons. Interestingly enough, I'm a nurse, and I started my career thinking I wanted to be a labor and delivery nurse and maybe even a nurse midwife. And so the first job I had out of nursing school was that I worked for an independent birth center that provided support for women who wanted to give birth either in a birth center outside of the hospital or at home. And so I traveled with very, very skilled nurse midwives who were able to support patients having their their babies in the home, in the hospital, or in a birth center. So they had all those options. And I learned very quickly the power of taking care and sort of really lowering the anxiety of patients by being in their own home environment, and how much you learn about your patient and your family, and how much more that then informs your care model. So on a personal, professional level, I have had the experience of doing a lot of home care, not with the frail elderly population, but with a population who's actually going through a very large transition in their life. And now at House Call Providers, I get to witness, not personally, but when I'm in IDT meetings, interdisciplinary team meetings, I get to witness the power of a provider being able to share all of the different dimensions of a patient's life that actually really inform the way that they care for that patient and can help them have the context they need to be able to put the most effective care plan in place. So I just think it's really powerful, and it lowers the, I believe that it levels the playing field. It lowers that kind of white coat anxiety that a lot of people face. And it's really convenient and helpful for patients to have a provider come to them.
You know, after 25 years, the beauty of this job is I am still amazed on a daily basis the impact that it has on these homebound patients as well as their caregivers. The difference you can make, because most of them have gone from a fragmented acute care system, you know, being hospitalized a lot, and really enabling them to stay at home. You know, the last thing I'll say is this has been shown to reduce 90% of nursing home placements. And what a joy to be able to fulfill families' wishes to keep their loved ones home and then just give them this loving care. It's a dream to me.
Because I think healthcare providers should go to patients and take care of patients. And sometimes I cite the scripture from Matthew, like about, I don't know if any of you remember or know that, it's about the goats and the sheep, and you know, the sheep, they say, like somebody is sick or is not well, then you go to them. Because if we are a provider, we are the healthy, we're the strong, we should go to the weak, to the sick, right? It should be that way. For the very old and the sick, it's just not right to me, but you should get them to you, like, and let them wait. So it doesn't sound right to me. So that's the way compassionate care should be.
I was trained as a social worker, and I used to do therapy in people's homes. So I've experienced it that way before coming to HCCI. And then my very first week at HCCI, I went out on the day of house calls with our former CEO, Tom Cornwell, and was sold. I mean, just seeing the way that the doctor is able to interact. And, you know, I think we've all had the experience of feeling a little bit rushed in a doctor's office, that they need, you know, that you're almost kind of afraid to ask too many questions because, you know, they have to get to their next patient. And that sense of urgency goes away in the home. And it's not that they don't have another patient coming, they do, but there's a way that it just all unfolds more slowly and with a different level of relationship. And it's just a wonderful thing to witness, and I'm sure for the patient to experience. And then on a more personal note, my mom was diagnosed in her mid-50s with early onset dementia, and unfortunately lived out the rest of her life in a nursing home. And, you know, I just wish every day that I had the ability to offer this kind of care to her. I didn't at the time, but I don't know, I just sort of feel like in a lot of ways, the work I do now honors her, and the recognition that this is what I think most of us would want for our parents and even ourselves when the time comes.
Many years ago, my surrogate grandmother and my grandfather were doctors. She in particular was well known. She was actually President Kennedy's physician, and she used to visit with me about what she thought the most important and the best kind of way to deliver care is in the home. And this is 30 years ago, 40 years ago. Home is where it should be. Home is where you live and where your heart is. And to be able to go into the home and care for people in their home, making it easier, supporting them in a loving environment, not a sterile waiting room or a sterile ER or hospital setting, is such a difference. And so there is no place like home.